So, good day, sir. I'm Mateo Medilo, sir, student nurse for today from MCNP. So, for today, I'll be assessing your musculoskeletal, sir, to identify the functional anatomy associated with clinical condition. But first, can you please state your name first, sir?
My name is Romeo Lucero.
How about your birth date?
My birthday is April 20, 1965.
So, for today, I'll be going to assess your I'm going to examine your musculoskeletal. Is that okay to you, sir?
Okay.
But before that, I'm going to perform a proper hand hygiene. So I'm going to assist the patient to a sitting position. I will inspect the upper extremities to observe the skin color, presence of lesions, rashes, and the muscles mass and palpate for skin temperature, texture, and presence of masses. Okay, the temperature is in normal condition. So next, I'm going to ask the patient to extend arms forward and then rapidly turn palms up and down. Sir, can you please follow me? Like this. So next, I'm going to ask the patient to raise both arms to vertical position, place hands behind the neck, and place hands behind the back. Sir, can you please follow me like this? Next, I'm going to ask the patient to flex up upper arm to resist examiner's opposing forms and instruct the patient to abduct the arms, adduct, and do internal and external rotations. Next, I'm going to ask the patient to squeeze my 2 fingers. As you can see, so there's no abnormal finding. Next, I'm going to assist the patient to supine position and examine the lower extremities and inspect the lower legs and feet for color lesions, varicosities, hair growth, nail growth, and edema and muscle mass. My patient is into already a supine position. Next, I'm going to examine the lower extremities and inspect the legs and feet for color. Okay, I don't see any abnormal findings like rashes into her skin, and his color is normal. Next, I'm going to test for pitting edema in the vertebral area, but my patient don't have abnormal finding into her skin. Her skin fit for color lesions. Okay, can you please follow me, sir? Abduct, abduct. Next. Next, I'm going to bend and straighten the elbow of the patient and inspect and palpate the hamstring, the wrist, and instruct patient to extend and spread the fingers. Make a fist with thumb across the knuckles. Sir, can you please follow me? Another one. So as you can see, there's a normal finding. So next, I'm going to palpate the radial and brachial pulses. Sir, can you please follow me? Please stop. So I'm not going to test his pitting edema in the vertebral area because I don't see any abnormal findings into his skin, color, lesions, varicositis, hair growth, nail growth, and edema and muscle mass. So I'm going to proceed to palpate for pulses in skin temperature at the posterior, tibial, dorsalis, pedis, and popliteal areas. Next, I'm going to instruct the patient to spread and wiggle the toes. Sir, can you please wiggle your toes? Just like this. As you can see, I don't see any abnormal findings into him. Stop. Next, I'm going to instruct the sole of the patient foot with the end of a reflex hammer handle or other hard object such as key repeat on the other side. Next, I'm going to ask the patient to dorsiflex and then plantar flex both feet against opposing resistance. And as needed, assist the patient in standing position and observe his or her range of motion. Sir, can you please stand? Next, I'm going to instruct the patient to abduct and adduct the legs. Sir, can you please follow me? Just like this. Other. Okay? There's no abnormal findings. Next, I'm going to instruct the patient to flex the knee and rotate laterally and medially one at a time. Sir, follow me again. It's like other one. And the last, I'm going to instruct the patient to perform dorsiflexion and plantar flexion and ask the patient to do internal and external rotation. Other one. Stop. Next, I'm going to instruct the patient to walk with the both feet and walk to and from. And I'm going to perform the Romberg test and ask the patient to stand. Where can you please stand and follow me? Next, I'm going to ask the patient to close his eyes with arms at side and wait 20 seconds and observe for patient swing and ability to maintain balance. Sir, can you please close your eyes? 20 seconds. Okay? I'm already done to okay, I'm done by examining the musculoskeletal of my patient and I don't see any abnormal finding to him. I'm going to perform the proper hand hygiene.